Hello, I'm Dr. Pamela Heibach Beach. I'm a professor of motor behavior in the Department of Kinesiology, Sports Studies, and Physical Education at SUNY Brockport. I'm also a co-director of the Institute of Movement Studies for Individuals with Visual Impairments. And I'm going to talk about a study that we did on affordances in the home for children with and without CHARGE syndrome. So environmental stimulation plays an important role in human development during a child's early stages of life. The home environment is really an important source of support for promoting motor development during those early years. And a young child learns a lot from interacting with the environment in a very meaningful way. So this notion of affordances within an ecological perspective provides a framework for understanding external influences on an individual's motor development. So under this perspective, affordances are aspects of the task, such as equipment. Are they playing with balls? Do they have outside equipment to play with? And the overall environment. So do they have playgrounds or larger pieces of work, equipment to play with? And what is the parental support situation? Are the parents helping to provide opportunities, and are they playing with their children? So children with more opportunities would then benefit, while children with lack of access may lag behind their peers in their motor development. So CHARGE syndrome is a genetic disorder. It's identified by a broad range of multisensory deficits. So a diagnosis is based on the presence of the CHD7 gene mutation, as well as a combination of major and minor features. The first aim of this study was to examine home environment affordances in young children with CHARGE syndrome to explain the multidimensional effects of these affordances related to motor development. And secondly, to examine the relationship between home environment affordances and the age of onset of motor milestones in children with and without CHARGE syndrome. So our participants included parents or legal guardians of children with or without CHARGE syndrome between 18 and 42 months. We had 28 parents of children with CHARGE and 32 parents of children without disabilities. We use the affordances in the home environment for motor development. This is a self-report instrument that assesses the quality and quantity of motor development opportunities in the home during these early years. It consists of 67 questions, and the inventory has 5 sections, 2 on the family and child's characteristics, and 3 on affordances of the home environment, such as physical space, daily activities, and play materials. All right, so this table revealed significant differences in the achievement of several motor milestones between the 2 samples. So specifically, the more children with disabilities or CHARGE syndrome, without disabilities could crawl, creep, stand, without support, cruise, walk, run, jump, and hop than the children with CHARGE syndrome. And you can notice a very low number of children that are able to hop only 1, jump only 5, and running only 7. So a low number. Then this table there shows that there were significant differences in age of motor milestones, wherein the children without disabilities achieved each milestone at an earlier age than the children with CHARGE syndrome. Due to the limited number of children with CHARGE syndrome who could run, jump, or hop, these motor milestones were excluded from the analysis. All right. So frequencies of affordance level of the AHEMD scores across the 2 samples are presented here. So we're seeing outside space, inside space, variety of stimulation, fine motor skills, and gross motor skills. So one notable difference is that there were no children without disabilities were categorized as very low for any component, whereas there was a small number of children with CHARGE syndrome who were categorized at the very low level. And also, there were no significant relationships between current age and age of motor milestones. With this measure, however, there were significant correlations for some of the demographic variables. So specifically, the number of children in the house had significant positive relationships with outside space, variety of stimulation, and the total score, indicating that outside space and the varied movement of opportunities were more available when more children were living in the home. There were also a significant positive association between annual income and a variety of stimulation, which suggests that wealthier families were able to provide more diverse movement opportunities at the home. So in conclusion, the findings of this study indicate that early experiences may be even more important for children with CHARGE syndrome in comparison to children without disabilities. And parents should help their children with CHARGE syndrome on their motor development. In addition, it is recommended for parents of children with CHARGE syndrome to work with their child support team to determine what would be the optimal home affordances. Thank you for watching.